of the food, and in the same time playing a role. It's play a role in modifying the acidity of the saliva, yeah, which affects directly to
teeth,
yeah, of
our
course,
teeth.
of course.
So every 12 hours you should brush your teeth.
At least. Yeah.
Oh, okay. Good piece of information. Now we have some photos, Dr. Yasser,
Yeah.
procedures that you've performed yourself,
Yeah.
and I want you to tell us, we have the before and after, tell us the problem
Yeah.
of this. We are going to see them on our plasma. Yeah, what's the problem here?
We can see here that there is let's say many cavities. The term in medical term is caries or decay.
Oh, okay.
Over the teeth in the labial surface. So we have two choices here in this case. Full crowns, that means we have to prepare the whole teeth and we have to grind it buccally, lingually, mesial, distal from the whole parts. So then we are playing role in destroying the teeth again.
Oh,
so
okay.
The other choice is just to remove the labial, let's say, defect from the teeth and replace it with these veneers.
Oh, okay. For me, it appeared like if you had done some bleaching or whitening for this patient.
We can't make bleaching for this patient because already they are badly destructed teeth. So we can't make bleaching for them. We have to remove.
So this cannot be. You have to remove the layer itself.
Of course, the layer, the bad layer, yeah, the destructed layer, and replace it with these veneers. Of course, they are the way which I use to make these veneers are direct way, like in the same time. Like this case, it finished within 3 hours. Not composite, it's ceramic veneers. We didn't take impressions.
So
and
the procedure itself, it only lasted for 3 hours?
Because it's different procedure than the normal procedures. Like you prepare the teeth, then take impressions, send it to the lab, and waiting for 2 or 3 or sometimes 2 weeks,
yes,
2 days or 2 weeks.
So generally, how is it made? How are veneers made?
This is what actually I want to talk about briefly. The veneers, there are many ways to do veneers.
Yeah.
There is direct or indirect way.
Okay.
Before, always the indirect way was better the direct way in the dental office. Like if we take impressions for the patient after preparing these teeth and send this impression to the lab, then he will manufacture these veneers by ceramic materials. Why the lab work on indirect work was better than the in-office work? Because in office in the past time we couldn't make ceramic in the office, but now we can by some chairs, CAD/CAM chair-side machines.
Oh, okay. So it doesn't take that long time that it used to?
No, actually in the same session, in the same time, by very high quality.
Good.
The whole thing now is computerized.
Very good. Now we have another picture on the plasma.
Yeah.
Here, what's the problem, doctor?
Again, we can say, see that these now what we are observing here that these are old restorations. Now already exist on the teeth.
Here I see that really the shape is not even.
Yeah, of course, because by this material we can sometimes make good shape, but it will not last for a long time because it's not ceramic.
Did this patient need braces earlier in his life?
Actually, not that much, because you will see after the treatment, the shape was very nice.
The after, this is the before. So here we see that it's really damaged, and there are cavities and decays, and the shape itself is not even.
Yeah.
Yes.
Yeah.
This is the after.
Yeah. This
oh my
is the
God.
after. Yeah. Of course, there is very big difference. It is within 4 hours.
4 hours.
Yeah, only 4 hours.
You did only the upper jaw?
Only the upper jaw, actually, because the lower jaw doesn't
appear that much.
Yeah. Normally, in the early age, we can notice that the upper jaw is very clear when you talk.
Exactly.
When we get older,
Yes.
the lower jaw starts to appear more.
Oh my God. Now you gave me a sign of, yeah, when getting older, what's going to happen.
Yeah.
Really very nice results that we're watching, and between the before and after. And I guess now there's a big revolution, so no excuses for having an unhealthy looking teeth. We are going to stop with a report and we'll be back. Please stay tuned. Welcome back. We are trying to make it clear enough for you how to have the Hollywood smile, and it's not really difficult these days. Back to Dr. Yasser, and we have more photos on the plasma. Here the case is what?
Yeah,
this is the before?
Yeah, this is the before. And if we see this, because it's the teeth here are healthy, let's say. So the patient has two choices. And I prefer the simple choice to add some
the problem is the gap, right?
The gap and the broken teeth.
Yes.
Okay. Very little. So we can fill it with some filling material without preparation of the two centrals, two teeth.
Okay.
But if the patient wants something will last for a long time, so we will offer him the veneers, telling him that we have to prep the teeth little. So we have to grind from the two teeth.
Wow.
Yeah, of course.
It really looks nice. And you used veneers as well here?
Here, actually, he chose the veneers.
Oh, okay. Really looks nice and healthy and perfect. This is really, for me, is perfect. The perfect smile. Okay, we have another one. We have more. Yes. Yeah, the
Again,
case here.
like the case the cases which you show before, two cases before. Again, these old restorations with some cavities or some caries.
And I guess the gum as well is damaged.
Gum, let's say here in this case, not so much, but we have to consider that the relation between the restorations and the gums are very important, because if there's gap or small gaps or overhanging materials inside the tissue, it will affect the gums too much, and it will appear like non-normal, non-healthy.
Okay. And this is the after.
Yeah.
Stunning, actually.
Yeah.
Perfect. Very nice. Looks really nice and healthy. And here, this again, it's veneers.
It's veneers. But here, like these cases, this color was the choice of the patient.
The color is a bit white?
Yeah, it was the choice of the patient. But if it is from my side, I will choose little bit yellowish, not to be natural looking.
Okay. But we all love the white teeth.
Of course.
Yeah, we all love to have the white teeth. Here, I guess this one that we have is really bad.
Yeah.
Yeah, what happened here, doctor? Is it an accident or what?
No, actually, let's say the patient was very afraid from the dentist. And
never went to a dentist till this stage.
Yeah, because he was very afraid. And when he knows that it's by only one session, so he was encouraged without any pain. Yeah.
This is the after.
Yeah, it's not veneers. It is crowns, full crowns, but with the same material of veneers, which is metal-free restorations.
But I guess you put some, you removed the old teeth and you put some?
No, we didn't remove. We just removed the cavities, the caries, I mean.
Yes.
When I say the cavity, and make some RCT treatment, root canal treatments.
This is another case?
Yeah, this is malposition of the teeth.
But actually, really, I love it. I don't know why people having such a
Yeah.
thing would like to change it. This
Not
is
only
really nice.
I like it, actually, not only the issue is, this can be corrected by orthodontic treatments,
Ah.
you know, but sometimes...
You mean not procedures?
Yeah, it's not indications for veneers. But the patient, when the patient, let's say he has some big social event, like when she's bride and
okay,
her,
she doesn't
you know,
want...
after 2 or 3 days, so you can save her, let's say.
Really, if you're a bride with this thing, it's really nice. You're gonna be unique, and this is the after.
Yeah, this is the
Yeah.
after, yeah.
Nice. More? We're having more with us, more cases. Okay, until it is prepared, I want you, doctor, to tell me the difference between the traditional dental veneers